Okay, so this is representing past the abdominal aorta, past that inferior mesenteric artery stub, and then I start to bifurcate. Bifurcate means split. There's a fork in the road. Why? Eventually I have two limbs to get to. So right where it splits, and these represent the ureters. And this muscle is the psoas major. And those are like your identifying markers, because this artery is called the right and left common iliac. But right after that psoas major, or right around the psoas major, we start to split that common into internal, and then this becomes called external. Okay, and for testing purposes, I'll be really clear on what it is I'm pointing, or where it is I'm pointing. So you can see the arrows once again. Common, this would be internal, and this would be external, iliac. Everybody see that? So now we're going to come out of the abdominal pelvic cavity and follow that same external iliac down through that cavity, and we're now in the inguinal region, right? Also early thigh region, anterior thigh, and it becomes called femoral. I could do the same thing here. So this is the external iliac through the abdominal pelvic cavity, and then right here it becomes called femoral, all the way down until we get to the posterior knee. So on this model, this right leg is representing the anterior view, and this is representing a lateral view. It's turned. You see how the leg is turned because the patella is this way. So this is femoral turning into popliteal. Popliteal. On this model, I cannot see it on that right leg. It's not viewable. So now, if I follow on the anterior view, the popliteal down, it kind of branches into anterior and posterior, but the anterior side is called anterior tibial. You can see that here and on this leg, and then posterior tibial here, which you cannot see on this leg because this is just the anterior view. So just like the arch on the upper extremity, we arch down here as well because we got the same kind of presentation with the toes. So there is a dorsal pedal arch, and really that arrow is supposed to be a little further down, so I'll make sure to change that. And it's the arch here. So the dorsal pedal arch, and then the artery itself where you take your pulse is that one. Kind of comes between the first and second digit, and that's where you would be able to palpate a pulse as well.